PrEP is pre-exposure prophylaxis.
What pre-exposure prophylaxis means is that you're trying to prevent HIV before an exposure has occurred. So that means that when somebody is taking PrEP, it means that they don't have HIV and they're trying to keep themselves from getting HIV by taking a medication to prevent it.
We try to promote the ease and availability of a once-a-day pill, but it's an actual program. It's a program where folks get an opportunity to meet with professionals, not only clinically, focus on treatment with STDs, but also counseling, their sexual health counseling.
PrEP for me is communicating with my doctor about my risk factors, being honest and open with my doctor and truthful about my sexual history, current and past, on top of the medication as well. So that once-a-day daily pill that's over 99% accurate in preventing you from acquiring the virus. All of that combined is what PrEP is to me. As a gay black male, I have a 50% chance in my lifetime of acquiring HIV. PrEP isn't just for gay men, it's for any and everyone who's experiencing risk factors in their life.
Anyone who's having unprotected sex with partners who doesn't know their partner's HIV status really is a candidate for PrEP.
When I think about PrEP, it's about me taking an inventory of where I am, being honest with myself, or as they say in the street, keep it real, to thyself be true. And if I sit back and do an inventory and know that, sometimes I can make some unhealthy and risky decisions, then this is possibly a medication that I need to consider taking. We talk about the younger population in terms of being at risk and the numbers being high, but what we don't talk about is the 50 plus being high. And so I'm 50 plus, right? And so this is very significant for me.
PrEP is a great option for college students. We often do a lot of mingling and meeting new people, so it offers protection and a sense of security.
It's appropriate for all demographics. And, I want folks to have an open mind about who's appropriate for PrEP. And that even, a low risk of HIV is too great of a risk.
We are lucky in New York State that our state benefits from a large needle exchange program, and through use of clean needles, people have really significantly reduced their risk of getting HIV through injection drug use. But that's still something that we need to really keep in mind, especially unfortunately as we're seeing more and more injection drug use. So it is a method of preventing HIV through injection drug use. And then also we know that sometimes when people are using, they may have higher risk associated with sex as well.
I experience a freedom being on PrEP, knowing that as long as I'm on my medication, I can be very intimate, right, with somebody, or I could possibly be in a relationship with somebody that's HIV positive and still have that companionship and that love and compassion that I would have with somebody who's not HIV positive.
It's actually given, my family and friends peace of mind as well. It's letting them know that, granted I have other things to worry about, but as far as, the big one, that I'm safe and I'm protected.
Others who are at risk for HIV, they have that panic inside of them all the time. It's affecting how they engage in relationships. It's affecting how they meet people. And that's really stressful. And PrEP adds the opportunity to take a step back and say, you know what, I can approach life in a different way and not panicking all the time about my HIV risk.
The PrEP pill contains two medications, emtricitabine and tenofovir. In the absence of PrEP, the HIV virus enters the body and attacks an important cell in our immune system, the CD4 T cell. The virus will fuse with the T cell and release its genetic material. It then copies or replicates this genetic material in order to assemble more versions of itself. Eventually, these viral copies will leave the T cell, spreading infection to other cells throughout the body. The medications within the PrEP pill block HIV's ability to copy itself, preventing the virus from spreading and setting up an infection within the body, keeping our T cells happy.
The pill only protects you against HIV, so you still have other things to worry about: syphilis, chlamydia, gonorrhea, trick, herpes, all of those other lovely things. I hate the idea that some people just say you get a pill and that's it, and you're out here to go be free and willy-nilly and do whatever you want, engage in all sorts of unprotected sex, and that's not the case. Like, that's the furthest thing from the truth on what PrEP actually is.
The people need to know that PrEP exists, because we still live in a community where people don't really know about PrEP, right? We live in a community also that has fear of acquiring medication, taking different medications because of some experiments that have been done in the African American community in particular, historically. So I think that people need to know about PrEP. They need to know that PrEP is safe.
Oftentimes when folks found out information, when they learned things, folks, because they knew better, began to do better. We should continue to increase our conversations about PrEP. We should continue to increase our understanding of how it can work, because we do know that in every situation, usually when you're talking about a relationship, eventually the condom must come off. So what other resources can we use? And I think continue conversations about PrEP, continue conversations about who PrEP is appropriate for, is definitely something we need to do.
PrEP is an incredibly important medication. It is part of the three-pronged plan in New York State to end the HIV epidemic by 2020, and I am so incredibly happy to report that progress towards that goal is going in the right direction. So in New York State, including PrEP as one of our three major components in fighting HIV, we've for the first time seen a significant drop in new HIV diagnoses across the state since the beginning of HIV medications. Medications are used to treat HIV. So this is really big news, and I think it says to all of us in New York State and in public health that PrEP is a really important medication.